Primary assessment. An emergency medical situation can happen anywhere. The interventions you perform on the patient, as well as the availability of resources and equipment, will ultimately determine the latter's condition. When an emergency situation occurs, a quick assessment shall be made to recognize life-threatening emergencies in order to provide an appropriate medical care. The primary assessment is the first course of action that every first aider goes through in responding to a medical emergency. The primary assessment consists of the following: checking scene safety, checking for responsiveness, introducing yourself, obtaining consent, calling EMS, and checking for vitals. Checking scene safety. You must gather an initial impression of your surroundings, situation, and the patient by performing a quick visual survey. In any emergency, you need to first make sure that the environment is safe for you, your team, and anyone else there. If you need to move the patient because of the presence of an immediate danger, do so carefully. When back, spinal, head, or neck injury is suspected, it is best to wait for trained emergency medical technicians to move them to a safe place. Remember that safety is your first priority because you, as the responder, should not add up to the number of casualties. The next step is another reinforcement of safety: application of PPE or personal protective equipment. PPE is used to prevent transmission of body substances from the first aider to the patient and vice versa. Checking for responsiveness. After ensuring scene safety, check for responsiveness. You may do this by first calling the attention of the patient. If there is no response, tap on the patient's shoulders. If the patient is still unresponsive, you may check response to pain by pinching the area of the hand between the thumb and the index finger or by performing a sternum rub. Introducing yourself and obtaining consent. Once you have checked for responsiveness, it is important to introduce yourself and explain that you are trained in first aid. It is also important that you obtain the consent of the patient first before giving appropriate care. If the victim is unconscious, obtain consent from those around you, the patient's family, friends, acquaintances, and if none, the crowd or bystanders. If you and the patient are alone and the patient is unconscious, consent is implied. Calling for emergency medical services or EMS. It is important to call or have someone call EMS before giving care to a patient. However, in instances where you are alone with the victim who either has severe life-threatening bleeding or is an individual younger than 12 years old who collapsed, care must be given first. This is because these conditions call for immediate first aid care, and no amount of time should be wasted. We'll discuss more about controlling bleeding in another video. Remember that when severe bleeding is present, it must be controlled first before proceeding to the next step. Checking the vitals. After calling EMS, next is checking for vitals. Open the airway first by performing the head tilt chin lift maneuver or the modified jaw thrust maneuver. To perform this maneuver, place one hand on the person's forehead. Place the fingers of the other hand under the lower jaw. Tilt the head back and lift the chin forward. If a patient has suspected spinal injury, then the alternative maneuver called the modified jaw thrust maneuver is performed. Place yourself above the person's head. Put the base of your thumb on the cheekbones of the patient. Place your thumbs on the chin of the patient and the rest of your fingers along the jawline. Thrust the jaw upward without moving the head and neck. Once the airway is open, simultaneously check the patient's breathing and pulse for at least 5 seconds, but no more than 10 seconds. We use the LLF method. Look for airway obstructions, listen for escaping air, and feel for pulse. Agonal breathing or isolated and infrequent breathing are not normal breathing. When you check the pulse of an adult patient, palpate the carotid artery by sliding 2 fingers into the groove of the patient's neck. Be careful not to reach across the neck and obstruct the airway. The results from conducting the primary assessment will be used to recognize the emergency condition and to determine the course of action needed. If the patient is unresponsive, is not breathing normally, or only gasping, but has pulse, they are in respiratory arrest. Deliver 1 rescue breath every 5 to 6 seconds. Each rescue breath should last about 1 second and make the chest rise. If the patient is unresponsive, is not breathing normally or only gasping, and does not have a pulse, they are in cardiac arrest. Start CPR within 10 seconds of recognizing cardiac arrest. If the patient exhibits normal breathing and has normal pulse, you may proceed to secondary assessment and treat other medical injuries or conditions. You may watch the videos on CPR and rescue breaths through the links in the description box below.